The study we present here is summarizing the preliminary results of our current trial for patients with primary acute myeloid leukemia, age 18 to 80. And the main results of this trial reflects that the complete remission rate using a rather conventional combination of vidarubicin and cytarabine leads to almost 80% complete remissions in patients up to the age of 70, which is a rather high remission. Another important observation is that if you take into account the molecular criteria of diagnosis and the minimal residual disease after consolidation chemotherapy, you may avoid allogeneic transplantation and its risks in more than 40% of patients, which is, I think, rather important because still nowadays we have between 15 and 20% one-year mortality in allotransplants for AML infer CR. And also that in patients without a favorable profile, still there is a lot of work to do because despite that practically 80% of the patients were transplanted in this high risk, which is a proportion which is very high compared to other trials. Most of them relapse after the procedure because they are negatively selected because they had high risk molecular features or because they had positive minimal residual disease at the end of chemotherapy. So in this group, which is basically composed by FLT3 ITD mutants without NPM1 mutation, and with also is composed by patients with adverse cytogenetics, something else has to be done. And now we have several opportunities because we have many target therapies. Some of them, like FLT3 inhibitors, have already demonstrated an added value to chemotherapy and eventually also to transplant. So I think it's going to be mandatory to combine before and after transplant these new target therapies, and also that we have to explore immune interventions after the procedure, after the transplantation, in order to potentiate the graft versus tumor effect and reduce relapses.
You mentioned these were just the preliminary results from the trial.
Yeah.
Are there any more results forthcoming, and what are the next steps?
Yes, we want to do, let's see, this is a try. I will be presenting here the results of somewhat more than 400 patients. We plan to extend this experience, and we want to do a more deep analysis of the results based on characteristics as age, time to transplant, also conditioning regimens. So yeah, more results are going to come in the next future. No, I think that only to say that the landscape of AML therapy is evolving, that probably it will be needed a combination of conventional therapy, including transplantations, with novel approaches like target therapy and also immune therapies in order to improve the results. But also a positive message is that I mentioned almost 40% of AML patients who get a remission may be a cure without the need of an allogeneic transplant in first complete remission. And that patients in the favorable genetic categories have event-free survival above 60% with chemotherapy only. So that thing is very important. It's different to what happened in the past.